Welcome, my friends, to the Bob and Brad podcast. My name is Mike, and I am filling in today for Bob. Unfortunately, he came down with a cold, and his voice isn't quite up to par yet. So I am filling in for today's podcast with Dr. Abbasi. Dr. Abbasi is a two-time guest. This will be his third time. He is a board-certified neurological surgeon, and Dr. Abbasi is one of the nation's leading spine surgeons. He specializes in minimal invasive spine surgeries. On today's podcast, we'll be discussing how COVID can affect your back pain, as well as various types of spine surgeries. So without further ado, please welcome Dr. Abbasi. So welcome, Dr. Abbasi, back to the program.
Always a pleasure to be there.
I am filling in for Bob today. For those of you that don't know, he is a little under the weather. But this first video, we are going to talk about back pain and how it can relate to COVID-19. So the first question I have here is, a few months ago, news broke out that comedian Ellen DeGeneres had some back pain while she had COVID. So my question to you, Dr. Abbasi, is, when did you first start noticing a relationship between COVID and back pain?
Well, regarding the connection between COVID and back pain, you have to go a little back, think about the overall relationship between any kind of viral infection or even any kind of general inflammation in our body and how our body deals with that. During any general inflammation and a viral infection is a general reaction of our body to a viral element. There are certain substances are produced in our body that actually are there to help our immune system to do a better job. Most of that are practically signals that our immune system communicates with cells that are going to literally attack a virus or a bacteria. Some of them are the interleukins, and anybody who had a cold knows how you feel. You have muscle ache, you have your joints don't feel the same. You're just down. Your body wants you to relax, don't do anything excessive. You want to concentrate on fight a virus or a bacteria inside of you. So we know for a long time that this general reaction, and a part of that is your temperature goes up, part of that is that you're just too tired to do things, is your body trying to adjust to fight the inflammation in your body. And COVID is no different. It's a viral reaction of our body that practically it is an upscale and extra strong cold. That's what COVID is. As a matter of fact, all these viruses are a group of respiratory viruses, same as cold, that they act in a certain way. And the reason that we cannot have the one single vaccine against that is because they mutate a lot. So as long as humanity has existed, this kind of viruses have existed, and our body always deal with that the same way. It tried to slow us down, it tried to let us get rest, and it tried to fight the infection in certain mechanism. Part of that certain mechanism is that all our tissue becomes painful, including our spine, including our muscle, including our joint. Now imagine if you have already some problem in your spine or in your joint, already there is something not optimal there. It's easy to understand that any viral reaction, any immune reaction going to aggravate that. So I'm not surprised. I have myself back pain, and I know that when I have a cold, my back pain is always going to get worse. So it's a natural reaction of our body, how it attacks the virus.
All right. Well, that's very fascinating. So how does back pain present itself with COVID? Is it different than your typical back pain, or is it something you can kind of distinguish easily?
Yeah, I would go back as well to answer that question a little about that COVID or any viral reaction. It aggravates symptoms you have. Part of that is a general malaise, like muscle ache that you have everywhere, including your back. But part of that is like if you had mostly back pain with certain position, that is going to be aggravated. If you had leg pain in certain position, that is going to be aggravated. Imagine that COVID just reduces your threshold to become symptomatic. More or less, everybody has some spine problem, except you are 15 years old and very healthy. By the time you are our age, everybody has some spine problem. Now, COVID reset that threshold that the problem becomes symptomatic. So the presentation is probably very different in every person, but one general common thread here is that you have this general malaise and muscle ache that is just aggravated with certain motion.
Okay. Is there like a timeline, like how long that lasts? Is it typically just while people have COVID and they're kind of active?
Yeah. Well, I'm sure you have had a cold, right?
Yeah, I actually had COVID too.
Yeah, no, but even a simple common cold. When you have a simple common cold, it takes about 3 to 4 days. And for the COVID, probably is a little longer, now maybe 4 to 5 days to become fully symptomatic. As a matter of fact, one of the first symptoms you notice is not the typical common cold notice. It's just that you notice you're just tired. Even before the full development of the COVID symptoms are noticed. And that general muscle ache and malaise and being tired is something that usually after a few days you notice. Every viral infection has a different kind of incubation, we call it. So, but generally the general malaise and muscle ache comes about a day or two before the full pictures are developed. On the other side as well, they are going to last longer than actual COVID symptom. That is like when you have a cold, the cold is gone, but it takes you a few more days before you are fully functional. For some reason, your body wants you to just take care of yourself, not do too much, so it still can recover from an acute phase of an infection.
Right. And this is, I think it's important to note, like Bob even kind of wrote it in the notes here, like Dr. Stuart McGill is saying, like, you know, some people when they get sick and they're hospitalized or they're bedridden, they're going to get back pain from being immobile. But this is not like this, because you're saying the virus itself is kind of bringing on pains or problems you might already have, right?
Yeah, and it's a combination. You know, obviously, if you're immobile, that you have already problem. I mean, if you have no problem whatsoever, a few days of not being mobile wouldn't really change anything. But yeah, imagine if you already have a problem, that it just put the problem over the top for you.
Right. So how does Inspired Spine, for people that are listening and haven't heard Dr. Abbasi before, that's where you work out of, how have they approached back pain and COVID-19?
Well, you know, that's actually extremely important question. And it has not directly to do with the viral infection. Obviously, you know, a viral infection of the COVID is an infection that has its phases and it's serious. And if you're elderly in certain situations, it can be deadly. But more than that is that the number of the patients that are getting that has truly in the last 2 years overwhelmed our hospital system, our healthcare system. Now, what is obviously what we do in a situation like that when our resources are not enough? We stop doing regular surgeries. We stop taking care of routine problems, and that these routine problems in the last 2 years have now accumulated to a point that there are lots of people that their problems have not been addressed. Now, the one question is, you know, why can we not take care of routine spine problem with COVID? Because these patients stay in the hospital for a whole week. They need a lots of resources that we don't have. And obviously, if somebody needs a ventilator and has a COVID and need treatment, we are not going to schedule any surgery who would need the same kind of care. Now, the good news is that the way we do the surgery, many of our surgeries are day surgery, like the time that most of the spine system were shutting down because hospital, for good reason, wouldn't let us do routine surgery. We could do those surgeries in a surgery center. As a matter of fact, this is public data that after regular fusion surgery, that is what we do. In average, patients stay in the hospital 4 to 5 days. This is public information. The state of Minnesota put those numbers out. Our patient, in average, stay 1.6 days, so almost 1/3 of the open surgery. But as well, it's about regarding the patient-centric care. Imagine you have a spine surgery and you have to stay 5 days in the hospital. The chance that you would get COVID from somebody else in that hospital, but let's be clear, those very severe COVID cases will go to hospitals, and doctors, nurses, staff inadvertently going to spread those agents around, those COVID viruses around. If you're in the hospital for 5 days, you're much more likely to contract COVID in the hospital than if you're only 1 day or not at all in the hospital. The way we address that is that obviously we make sure that you don't have an actual respiratory issue, because if you have an actual respiratory issue, your back problem have to take the back seat. But if you don't have any actual respiratory issue, we still perform surgery in the COVID time because our patient don't have to go to the hospital, and if they have to go to the hospital, stay there the shortest possible. So contrary to other spine services, we still are able to help our patient.
If a person no longer tests positive for COVID-19 but is presenting with back pain yet, do you feel comfortable proceeding with surgery?
Absolutely. Like any other kind of viral disease, COVID has its phases. Once you're out of the acute phase, people recover from that, and to my best knowledge, at least for the strain of COVID they had, they actually acquire some immunity. So having said that, is no different than having any other viral infection. Once you're over the acute episode and respiratory-wise you're stable, there is no reason not to take care of patients' other medical problem.
All right. Well, that's good to hear then. I guess the last question on this topic, are there any other challenges that back pain related to COVID-19 present for people?
Yeah, absolutely. And again, it's not a direct relationship between COVID and the virus. It's about that this patient for 2 years haven't gotten any treatment for their spine. Many of these patients have been put on back burner. Like right now, we have like over 280 backlog for surgery. People who do need a surgery, but we cannot provide them with that offer. Now, you can imagine that if you have already a spine problem and it's not taken care of, just 2 years past, you're not better, you're worse.
Yeah, so it's just gonna be worse.
Absolutely. These patients are, and it is not just worse for your spine, because you're a young man. For you, is not as acute and important like somebody who's my age or 60 or 70. A 70-year-old person who doesn't walk because he has back pain, they decondition so fast. As a matter of fact, if you're 80 years old and you don't walk for whatever reason, your prognosis is poorer than if you get diagnosed with cancer. If by the time an elderly stop walking for whatever reason, their cardiovascular system, the heart, lung, they decondition pretty fast, and now 2 years later, they're 2 years older, but they aged 5 years, not 2 years, because they couldn't walk. Now their back problem is worse, and it needs more surgery, bigger, because it's a bigger problem. And now you're doing a bigger surgery on somebody who aged 5 years in 2 years because he wasn't really ambulating and deconditioned. So yeah, these are huge challenges added to our healthcare system. But again, you have to take care of those patients as soon as safely can, because postponing it indefinitely, it's just going to be backfire on us.
Right. Yeah. I mean, I know exactly what you're talking about, because working in therapy realm, we've seen people like that, and they will just, as soon as they stop walking, decrease. If you can't get those problems fixed early on, I mean, it's a downward spiral. So
Lots of people don't know that. If you are an elderly and 80 and above, if you quit completely walking for whatever reason, your life expectancy is about 6 months.
Yeah, I mean, it significantly
Because
drops.
you decondition and your heart shut down. This is a deadly disease. We have to understand that.
All right. Well, I think that gets everything we have for questions here. Do you have any last comments or remarks you would like to add about anything?
No, thank you so much.
All right, and that concludes today's podcast. I hope everyone enjoyed it. I apologize. We had some lagging internet issues, so hopefully I am able to fix it up enough so it is tolerable to listen to. Make sure to come back next time for more interviews with experts on the Bob and Brad podcast.